Are the symptoms similar?
The symptoms are somewhat similar, but in some cases, but when you have classic cases of eczema and classic cases of psoriasis, they're very different. Psoriasis tends to present on the elbows, the knees, the scalp, the lower back.
My mom said it would itch and it would hurt, and the way to get it treated would be with cortisone shots.
You know, some people do that. We tend to avoid cortisone shots unless they have a solitary plaque. If they only have one lesion.
What does that mean, a solitary plaque?
Just having one area, let's say on their knee or on their elbow, that's resistant to creams or other therapies that we use, then you can inject cortisone shots. Tend to be painful, and if you have psoriasis areas all over, it's not a #1 treatment. But psoriasis tends to present in those common areas. They tend to be silvery plaques, very inflammatory, and you tend to use creams. You can use light therapies. We have other injections that we can do. We have oral medications. So psoriasis, being one of the most widely studied skin diseases, has one of the most widely...
Treatment on the rise.
Exactly. Has many different treatments available for it.
Okay, so then, doctor, what about eczema?
Well, eczema is also a genetic condition. Primarily affects children of any age and can also affect adults. It tends to present on the arms, the legs, in specific areas, and also on the face. And like psoriasis, it's been widely studied, but doesn't have as many available treatments as psoriasis.
Okay.
And of course we have to ask about skin cancer. When is a mole an innocent mole, and when does it become a troublemaker?
Well, generally I tell patients if you notice any new or changing moles, that's a warning sign. Up until about the age of 30 or 40, you can get new moles. It's not unusual. But what you want to watch out for are moles that are new or changing. And when I say changing, I mean in size, color, shape, or borders. So if the size is rapidly enlarging, that's a warning sign. If the borders are jagged or irregular instead of round and brown, that's a warning sign. If the color has any of the American flag, red, white, or blue, purple, black, that's a warning sign. And so you want to see your dermatologist immediately.
Doctor, real quickly, what is a mole?
Well, a mole is a collection of skin pigment producing cells.
Okay.
And so they kind of cluster together, and they can either form a bump or they can even be flat, and they tend to present as round and brown. So that's generally a good mnemonic to remember.
But we see freckles, and that's a different thing. But it is the interaction of sun on the skin in a different way?
Exactly right. Whereas a mole is a collection of all those skin pigment producing cells kind of clustered together. Sunspots or anything else that might be dark as a result of the environment tend to be the normal skin cells producing more pigment in response to the sunlight or whatever causes it to become dark. Sometimes it's just an insect bite that goes away. Those skin pigment producing cells will produce more pigment and you'll be left with a dark spot, which eventually will fade.
Does sunscreen help us prevent skin cancer, or is that protection factor maybe overrated?
No, it absolutely does help you prevent skin cancer. The #1 way is to avoid the sun completely, but for people who cannot do that, sunscreens and sunblocks are excellent ways to prevent skin cancer.
So basically what you're saying, though, is to just pay attention to your body, because we've had doctors on here a lot that just say you are your own doctor. Actually scope out your body and see if there's any changes and see what's going on.
Absolutely, absolutely. One helpful tip that I give patients in the office is, especially for their back, even if you have somebody at home who can look at your back once a month, take a digital photo of your back, divide it into 4 quadrants, label it left upper, left lower, right upper, right lower, and put those photos on your hard drive. So you can zoom in on any mole that you think might be changing when you do your monthly exam.
When we come back here on HEALTHline, we are going to ask Dr. Mehrabi about cosmetic procedures that he performs and where you get the most bang for your buck if you want to maybe rejuvenate a little bit in your later years.
Don't go away. Welcome back. I'm Gregory Zarian, along with Suzanne Watley and our fantastic guest, Dr. Don Mehrabi, dermatologist. And you've done some stuff to me. And before we went to break, we were talking about cosmetic surgery. Talk to us about the magic of cosmetic surgery.
Well, dermatology has advanced a lot in the last 10 years. Botox, I mean, essentially flows like water now. And now we have a whole bunch of other injectables and other procedures that we can do to enhance your look without having to do surgery. So the field of cosmetic dermatology has exploded. Some of the exciting new advances obviously are the different fillers that you can do, different types of laser resurfacing and different types of laser procedures that you can do.
Go back to fillers real quick. So we have
Sure.
Botox. What are some of the fillers?
Well, Botox is not a filler. Botox is a muscle relaxer. So it relaxes the muscles that cause your wrinkles. Generally used for the upper face, so you want to use it around the eyes, between the eyebrows, and for the forehead. And with advanced techniques, you can actually treat areas like the chin, the jawline. You can
I
also,
even heard under the nose to make the nose not a beak.
That's
per
right.
se.
You can actually, that's a little bit harder to do, but you can actually treat the tip of the nose to make it lift up a little bit, and also treat gummy smiles, bunny lines right here. So there's a lot of different uses for Botox. You can also do necklines.
I've heard of it.
I've heard it lamented in Hollywood that so many actresses over 40 can't exhibit this normal facial expressions because they've had a lot of Botox procedures, that finding someone who can facially emote is kind of tricky.
Well, it's a very widely done procedure, and sometimes it's overdone. You know, to be honest, some people come in a little bit too much and get too many units placed, and yeah, do lose some of their facial expression. The trick is to do it naturally, so you're preventing the wrinkles, but you're still able to make those expressions.
And you still get movement. Now back to the fillers.
Oh.
What are some fillers?
Okay, well, the main fillers on the market are Restylane, Juvederm, and then there's also Radiesse. Restylane and Juvederm are hyaluronic acid, and essentially all you need to remember is that this is a normal, natural component of your dermis, the second layer of the skin. And what we do is essentially plant that in the second layer to plump up the skin. So any folds or wrinkles you have, we use that to fill them up.
How long does that last?
Anywhere from 6 to 8 months.
Botox lasts
Sometimes
what?
longer. Botox is about 3 to 4 months. And then there's Radiesse, which is a component of bone, believe it or not. But we can inject it into the second layer of the skin, and it causes the collagen to form around the particles that you inject. And it naturally fills on its own. And that lasts for about a year to a year and a half.
And is that better for, say, filling a hole as opposed to the lines, or are they all interchangeable in terms of their uses, these fillers?
Some fillers have better uses in some areas than others. For instance, Juvederm, Restylane, you can use on the lips, whereas Radiesse, you would not want to do that. And Juvederm and Restylane you can use underneath the eyes, whereas Radiesse, you wouldn't want to do that. There are also other fillers that I haven't mentioned. You can use your own fat as a filler, and they call that fat transfer. You can actually do that. And there's also a filler out there called Sculptra, which can actually fill in your entire cheek. And the new wave in cosmetic dermatology is to actually cause a lot of filling, not only in the lines, but in the areas around the lines, like your upper cheek, to kind of stretch out the skin and relieve those lines as well.
Should someone, if they want to do kind of a makeover, should they go with a laser treatment first and then fill what hasn't been dealt with in the laser treatment?
That's actually a great question. Laser resurfacing is probably one of the hottest procedures. Because
Literally and in terms of popularity?
Both. It can erase wrinkles, scarring, pigmentation from the sun, a lot of signs of skin damage and aging. But done alone, it does a great job. But if you use the fillers, you use Botox to augment those effects, I mean, you just get a phenomenal result.
Are you finding that Botox and fillers and the laser resurfacing is taking over facelifts?
It's definitely competing with them. Sometimes for some, it depends on the patient. For some patients, a facelift is the best option for them, especially if they have saggy cheeks or saggy jaws. No laser, no filler is going to really get rid of that. So you need a surgical option
Jowls?
to push back. That's right.
Oh.
Did I say jaws? Yeah.
No,
Saggy
you said jaws, Suzanne said jowls.
Jowls, yeah. So if the jawline or the jowls are saggy, then a surgical facelift is a good way to go.